My name is Angela Allen, and I was the principal here at Monticello Middle School. I was approached by the Cascade Alliance and a local pediatrician to support our school with a pilot project because our school was identified as needing some support with attendance and maybe discipline behaviors. We just decided to immediately just jump right in and get started because I knew the amount of kids that we had and the services that they were lacking. The pilot project was started last summer that incorporated a nurse care coordinator and the school to establish one more person in the building to connect families with more services, be it medical, mental health, behavior, dental. It was another person to make those connections for families to get the help that they needed. The problems that we identified that were really the ones that rose to the top for a lot of our kids are just mental health needs. They present themselves in various ways, from withdrawing to not doing their work. They also are not coming to school. They have discipline issues with themselves getting in trouble, but also with other students. And so not knowing how to process that. So we would see a lot of those types of behaviors. And our first reaction is not necessarily to you have this issue that you're in trouble for, but it's not discipline. It's to look at what are the underlying pieces that are leading and causing this behavior that we really need to look at instead of the punishment. I think that the role of the principal in the building, you have to look at the whole picture, and I think that is what any good leadership would do when they're working with their kids. You want to prevent issues later for them down the road. Some of these kids don't have parents to go home to talk to, so I just want to be that support for them. And so that was just the importance of having this project come to the building, was this one more way that we can support them and help those kids be successful. This has been the push that we needed to have that extra support that we obviously have to have happen to get all the services to kids that need them. I think the Accountable Communities of Health has been instrumental in providing the support for letting this program come together. That piece has been just a blessing for Monticello and the kids that have had access to the extra support, be it dental, medical, the mental health. Those pieces have been just huge for a group of kids that we identified. When they're happy, they're learning, and that's all I'm supposed to be doing, is making sure that they're happy and they're learning.